Good evening and thank you for joining us. COVID-19 cases continue to rise across northwestern Ontario. And for the first time in 9 months, there are more than 200 active cases in the Thunder Bay district alone. The health unit is reporting 69 new infections today. 67 of them are in the Thunder Bay area, while 2 come from other communities. There are 12 household contacts and 17 close contacts from outside the home. 5 cases are related to travel outside of northwestern Ontario. 35 exposure sources are still unknown at this time. There's 1 new hospitalization, bringing the total number of people in hospital to 4. The 215 active cases are the most since March 28th. The Northwestern Health Unit is reporting 35 new cases. 11 are in the Dryden Health Hub. 9 are from the Red Lake Hub. There are 6 cases each in Kenora and Sioux Lookout, while Emo and Fort Frances each have 1 new case. 4 people remain in hospital with no new hospitalizations today. There are now 220 active cases across the NWHU's catchment area. That steep rise in cases locally is disconcerting, says the district's medical officer of health, but she expects those numbers to continue to rise. And from now on, those outside of high-risk settings who are confirmed to have the virus will be responsible for informing close contacts themselves. Corey Nordstrom explains.
Medical Officer Dr. Janet DeMille has confirmed what many expect about the massive jump in cases seen in the Thunder Bay district.
I think what's happening is basically we're now being impacted by what's happening in the rest of the province and in other parts of the country. That it's largely this new variant of concern, the Omicron variant, that's spreading.
DeMille is also on record saying that there is community spread in the Thunder Bay area. With that, the TBDHU is changing its process for contact management. Health unit staff will focus on follow-up for high-risk settings with more vulnerable populations.
Any cases in a long-term care home or retirement home or other congregate living settings. Cases associated with hospitals, for example, staff or a patient in a hospital. Schools and daycares are also something that we will be following up on.
For the average person, informing close contacts will be their responsibility after testing positive, with guidance from the province. Dr. DeMille says now that Omicron is here, following up with hundreds would be too tall a task, especially when staff are needed on the front lines.
It would be virtually impossible for us to do all the case and contact management the way we've done in the past. So, and what we are trying very much to do is divert some of our resources or reallocate our resources to immunization.
Ontario's top doctor is slated to speak Thursday, most likely about whether schools will be open next week. DeMille did not want to talk about her recommendations for in-class learning in this district, but she's hoping for some other changes to be announced by Dr. Kieran Moore and Premier Doug Ford.
I do expect to see more requirements for household members to isolate, even if they've been vaccinated with 2 doses. So that will put a burden on people and families, but it would actually help mitigate some of the transmission that we're currently seeing.
Corey Nordstrom, TBC News.
Meanwhile, the medical officer of health for the Northwestern Health Unit did talk about schools today. She believes students should return to the class following the holiday break. Dr. Kit Young-Hoon says that while case counts are on the rise across the NWHU's catchment area, the physical and mental health benefits of students being in class outweigh the risks. She insists many of those risks are mitigated by masking and distancing measures, but she notes that's only a piece of the puzzle for pandemic response, and she believes a bigger picture perspective from the province is still required at this time.
So we are looking to them to provide a clearer idea of the strategy moving forward. So based on our local assessment at this point, we are perceiving that it is best to keep schools open at this time, looking at the overall health of the child. Another thing that has to be mentioned, of course, is the impact that school closures has on the available workforce. So right now we are trying to ramp up 3rd dose vaccination rates.
Dr. Young-Hoon believes across the board, school closures should be avoided in favor of a targeted approach in the communities with high COVID case counts. On the NWHU's vaccination front, 93% of people 12 and up have 2 doses, and 40% of the 5 to 11 age group have now received their first dose. Ontario has set another daily COVID-19 record with 10,436 new cases today. And the big question on the minds of parents as case counts continues to soar is the one that we've been talking about, whether or not students will be back in the classroom next week. Premier Doug Ford has promised an answer in the next few days. Mike Walker has the latest details.
As parents race to get their children vaccinated at this clinic in Mississauga, the fate of in-person learning looms.
We both work, and it's really hard for us to our kid not to go back to school.
Better they learn in person, going to school, like, for socialization and all.
Premier Doug Ford signaled yesterday a decision would be coming this week as to whether in-person learning would resume on January 3rd amid record-setting case counts.
It's good to know as soon as possible. You have to plan ahead, right, with small children, and as much time as possible. Whatever you have to arrange, daycare, babysitters, whatever.
But given the dominant Omicron variant, some health experts say a return to in-person learning could be challenging.
If you open schools up on January 3rd, the number of cases we have is likely to result very quickly in a large number of transmission events between students, between teachers, and we're just having a wave that's coming, that's surging at the wrong time.
We haven't heard anything from the government about how that could be possible, and if it is possible, what's going to be done to keep teachers, staff, and students as safe as possible.
Best thing you can do is get vaccinated.
But physician Dr. David Jacobs says there are additional measures that should be considered, specifically for teachers to help limit the spread.
For the teachers, I think that they should be given the option of wearing higher quality masks. I would recommend it, but that again, they're adults, and that's an option that they should use should they choose to use it.
For now, parents can only wait, hoping for an answer as soon as possible.
Well, that was CTV's Mike Walker. Premier Doug Ford will reportedly meet with his cabinet tomorrow to discuss whether or not schools should open as scheduled in the new year. Fire investigators have wrapped up their on-site probe at the Finnish Labour Temple following last week's devastating fire, but the cause and origin of the blaze still haven't been confirmed. Ontario Fire Marshal's investigator John Mercier was back on scene yesterday alongside local fire officials, but he wasn't available for an interview. Instead, a spokesperson with the Fire Marshal's office released a statement today saying that every incident and subsequent investigation is unique and some fires take longer to investigate than others. This probe continues and they can't comment further at this time. The spokesperson did confirm that a portion of the 3rd floor has collapsed into the 2nd floor and it's unsafe to enter. The keys have now been turned over to the building's owner. Brad McKinnon says his engineer has determined the structure is at risk of collapsing due to fire damage and the weight of the frozen water inside. Because of that, he plans to demolish the remains as soon as possible and then rebuild the historic structure. The Thunder Bay Police Service has issued a warning about cryptocurrency scams. Police say one local victim was defrauded of $500,000 by an unregistered investment platform on the advice of a Facebook friend. Another victim was investing in Bitcoin with a company claiming to be based in the UK. After investing for several months, the victim requested a withdrawal. At that point, the company demanded a $10,000 payment to transfer the investments into cash. Police are now urging people to check the legitimacy of any online investment platforms by visiting the Canadian Securities Administrators website. They add no reputable organization will demand that payments be made in cryptocurrency. This month's Thunder Bay 50/50 draw continues to reach unprecedented heights as the jackpot has now surpassed $2 million. The running tally hit the milestone just after 12:30 this afternoon, and it's currently sitting at around $2,050,000. Tickets are still up for grabs until midnight tomorrow, and the big draw takes place on Friday morning, New Year's Eve. The previous high for the Hospital Foundation fundraiser was the first draw back in February, when the winners took home $965,000. Since then, another 9 monthly prizes have been handed out, with the 50/50 payouts totaling more than $6.2 million. We'll have details about the latest and largest winner on our Friday newscast. While many people aren't thrilled about the 20 to 30 centimeters of snow we've gotten over the last couple of days, skiers at Mount Baldy are thrilled with the huge dump of the white stuff. The ski area has also been able to open up more runs on the hill thanks to Old Man Winter. Mitchell Ringos has that story.
Up until this latest snowfall, Mount Baldy crews have been running their snow guns non-stop. But now, with a fresh coat of snow, not only were they able to move most of their guns to the main run, but they were also able to open the Gold and Hornet runs for local skiers and snowboarders, along with another run called the Shotgun, which is expected to open up on Thursday. As for the main, Mount Baldy co-owner Daniel Cardis thinks it will take around 2 weeks to open. But if we get another big snowfall, that timeline could be moved up. More snow would also be beneficial to the Lookout Run as it depends on natural snow.
And then the Lookout, generally we don't have snow-making capacity right now, maybe next season. But that's all natural snow, so we kind of got to wait on Mother Nature, and it is facing the lake, so you got a lot of wind on that side, so it's a little bit wind blown.
We talked to some locals here at Mount Baldy Ski Resort to see just how happy they were to get so much snow here in Thunder Bay.
Wow. Oh, it's beautiful. It's really great. You go on the Gold, tons of snow along the edges and still and everything. Beautiful.
Yeah, it's pretty great. The conditions are pretty good. It's been really nice. The powder's super soft. All the hills are really fresh, and it's really fun to ski down.
Yeah, and then we're just doing some rails, and it's fun. If you fall, it doesn't hurt.
It is amazing. It's probably like the most fun I've had, or most fun season I've had yet.
It's really good. We could actually get some nice carves in and stuff.
Yeah, I like it a lot because I could do more, go downhill and stuff.
And jumps.
The hill also increased their hours as they are now open 10 to 5, running all week for winter enthusiasts to come and ski or snowboard down the multiple runs, or to just come out to have a nice slide down the tube track.
It's great to see all the people coming out and with their boards and skis, and the tubing's been busy also, so grab your skis, boards, and if you don't have those, come on out and try our tubing. It's pretty insane.
Mitchell Ringos, TBT News.
Well, Mitchell, you are now indoors here with